2. So tell me, young man, how long has his wound been on this foot, on this toe?
Over a year.
Over a year?
Yes.
And how do you sleep at night?
Approximately 2 hours after that is enough pain to cause me to get up, and normally I don't go back to sleep that night.
I see, because of the pain.
Because of the pain.
And the wound has been here for over a year?
Yes.
On this 5th toe?
That's it.
Okay. We're going to do a little procedure today called PRP, and let's see what kind of results we get.
I'm looking forward to it.
All right, let's see what happens. Good enough. How are you today?
I'm very good.
Good. This is 1 week after you had your PRP injection.
That's right.
How do you feel compared to before?
Much, much better. There's been a 180-degree difference.
So before you had a lot of pain at night, how does your pain now compared to before?
It's not non-existent, but it's not as much of a factor as it has been, and it's improving daily.
Is he walking better?
Oh yes, he's walking a lot better. He walked to an appointment with his cane, which is something he hasn't been doing. So that tells me that his circulation has greatly improved.
And it's only been 1 week.
Yes.
And we've got another 5 weeks to go before this is over. And this toe is actually looking better too, already. I think it's going to be okay. And what do they want to do with this? Our injection therapy has done a lot. Are you sleeping better at night?
A whole lot better. Infinitely so.
Is he sleeping better, Mom?
Oh yes, he is. He is, and his outbursts at night have greatly diminished.
You say outbursts?
Yes. Well, they would wake me up, so they would be outbursts.
Right, I understand. So that's wonderful. And the toe looks 100% better too. Look at that. It's greatly improved compared to how it was before.
It was a lot bigger and a lot more color. Red color to it is gone.
That's good. That's
the
good.
The pain has diminished significantly.
Fantastic. Okay, we're going to do one more dose today.
Yeah.
How do you feel today?
Good. I feel very good today.
Now, you were recommended for amputation, but first they wanted to do another bypass surgery.
Second bypass.
Because what happened to the first one?
It failed.
It failed.
It failed.
And what did they recommend after the failed bypass?
They recommended a second bypass, and if that turned out like the first bypass, it was going to be amputation of the left foot.
So far you've had 2 treatments.
Yes.
Okay. And how do you feel at night compared to before?
100% better as far as problems at night. No problems.
And prior to this treatment, what were your nights like?
I could depend on a pain severe enough to either require me to get up and stay up or get up and take a drug and go back to sleep.
And now, are you taking drugs?
No.
No need for any medication?
Not for the...
Are you sleeping through the night?
Most of the night, yeah. But no problems with the foot.
That is amazing. That is amazing. And you saw the surgeon last week, and what did he say?
He was improved with he was impressed with the improvement in that wound. And as a result, this was a pre-op appointment with the surgeon, and he deferred the surgery until this is completed, and if it goes as indicated by the last examination, the surgery won't be necessary. The amputation
Beautiful.
will not be required.